All right, welcome back. This tutorial is the second in the bioavailability series, and in this video we are gonna have a look at the calculation of bioavailability. If you haven't seen the previous tutorial, I highly recommend watching it before continuing it with this video, as we will use terminologies which is defined in the last tutorial. So I am gonna begin with the bioavailability equation. So what is that equation? The equation is a bit conceptual, as you see here. That wait, let me get the pen. Okay, so here is the equation. If you see F is the sign for the bioavailability. Our bioavailability is denoted by F is equal to area under the curve of oral multiplied by area under the curve IV, divided by area under the curve IV multiplied by 100. So this is the equation for the bioavailability. We compare the area under the curve of IV doses with the oral dose. Suppose we are giving oral dose and we want to check its bioavailability. So what we will do, we will give an IV dose and check the bioavailability. Then we will give the oral dose, and after oral dose we will check the drug concentration in the plasma, and then we will compare the concentration of the drug given IV and the concentration of the drug given oral. So by that comparison, we would come to know that how much of our drug is bioavailable. First, let's see how to know that what is the concentration of the drug in plasma. So the concentration of plasma is calculated by concentration of plasma is equal to mass divided by volume. First, we will see what is the mass. Mass, that is the drug in the systemic circulation or the dose given. This is the mass. Whatever the drug we give, the actual amount that we give, and that is not the mass. The amount in the blood circulation is the mass. The second one is the volume. And what is the volume? That drug is distributed in how much of the plasma that is drug distributed in the specific amount of the plasma that is taken in liters or milliliters. So now drug is always mixed in the plasma. First, let's see what is the difference between the blood and the plasma. If I say blood, so blood volume is the 5 liter, and that is the plasma volume plus blood cells. So by plasma, and when I say plasma, so by plasma I mean blood cells minus that fluid that gives us a plasma, and plasma is the 2.5 liter normally in a human body. Now let's learn or understand this via example. We will take an example of a drug. So here is an example. Let's suppose we demonstrate 50 mg of the dose of diclofenac sodium IV with the 100% bioavailability. What would be diclofenac sodium concentration in the plasma? For that, we know that concentration of plasma is equal to mass divided by volume. The mass of the drug, that is the 50 mg, and what is the volume of the plasma? That is the 2.5 liter, as we know. So mass is the 50 mg, volume is the 2.5 liter. So the formula is the same, just we have to put the values. So concentration plasma is equal to 50 mg divided by 2.5 liter is equal to 20. If you divide this, the concentration of plasma will be the 20 liter 20 mg per liter. This is for the IV drug. Now we will discuss an example for the oral drug. Now in the second case, if I give the same drug but administered it oral, then what will happen? So now this case, what happened that you take the drug orally from let's see, we take the drug from oral route. This is the drug, and it goes to the oral cavity. From oral cavity it goes to the stomach. From stomach the drug moves to the intestine. From intestine the drug moves to the liver, and after metabolization in the liver the drugs goes into the blood circulation. This is the normal pathway for the oral drug administration. Now let's see what happened. We give the same amount of the drug, 50 mg, and it goes via the oral route. So there is no changing in the oral cavity, so drug will direct goes into the stomach, and after digestion in the stomach because of acidic medium, we lost the 5 mg of the drug, so we will get the 45 mg in the intestine, and in the intestine the 40 mg is absorbed and 5 mg again we lost, and 5 mg goes in the feces. So we will get the 40 mg in the liver. After metabolization in the liver, we again lost the 5 mg, and we will get the 35 mg in the blood circulation. This is the comparison between the oral route and in the IV route. In the IV route, we have the exact amount. Whatever we administer, we have the exact amount in the blood circulation. So let's see via the equation. As we know that the concentration of plasma is equal to mass divided by volume. So what is the mass with us? Mass is the 35 mg. As we administer the 50 mg, but we have the only 35 mg in the blood circulation, so that is the our mass. And what is the volume? We know that plasma, a normal human being, is the 2.5 liter. So the concentration plasma is equal to 35 mg divided by 2.5 liter, and we will get the 14. The answer is the concentration of plasma is the 14 mg per liter of the diclofenac sodium. So now the concentration of the drug in the plasma is reduced to the 14 mg per liter in this case. If you given the drug orally, per liter of your plasma has only 14 mg per liter of the drug, and when you give it the intravenous, per liter of the plasma had the 20 mg of the drug. This is how you can find the concentration of the bioavailable drug in the plasma. Now let's go back to the our first equation that was about the bioavailability. So our first equation was the F is equal to area under the curve of the oral divided by area under the curve of the IV multiplied by 100. So we will learn this via an case problem. Let's see. Atenolol is the drug that is used in the heart disease. When 50 mg of the atenolol enters into the blood by IV route, and the 25 mg reaches to the systemic circulation or the blood by oral route. So what is the bioavailability, or what will be the bioavailability? Let's calculate it. What is the area under the curve of the oral? We know that is the 25 mg. 25 mg is the area under the curve of the oral, and what is the area under the curve of the IV is the 50 mg. We know that. So let's see. As we know that bioavailability can be defined by F is equal to area under the curve oral divided by area under the curve IV multiplied by 100. We know the formula, so let's put the values. the F is equal to 25 divided by 50 multiplied by 100. So F is equal to 0.5. If we multiply both of these things, we will get the answer 0.5, and we will this is divided. As we divide 25 by 50, we will get 0.5 multiplied by 100. So what will we get? The final amount is the 50. So bioavailability of the ethanol is the 50%. Hope you guys can understand, and thank you for watching.